When we started the Open Heart program at Yavapai Regional Medical Center, our mission was to bring world-class cardiac care to this region. Now, our patients can stay close to home with the support of family and friends and receive the highest level of care by caring and compassionate people. I'm Pierre Tibby, Director of Cardiothoracic Surgery at the James Family Heart Center at Yavapai Regional Medical Center. The moment you enter our door, you will be cared for by experienced and motivated professionals who share one common goal: to get you back on your feet and enjoying what matters most to you. Your healthcare team has successfully completed hundreds of cardiac surgeries, the same types of surgeries being performed at any other major heart center. But there's one difference. We call it the YRMC difference. It's the personal touch that our team adds to your experience. In fact, this video is a good example of the YRMC difference. Over the next few minutes, you are going to learn about each phase of your surgery, from pre-admission through recovery. You will get to meet many of the actual people who will care for you and your family. You will see for yourself why our open heart surgery program has received international recognition for excellence. I want to thank you for choosing the James Family Heart Center. We look forward to providing you and your family with the highest level of care and the utmost comfort and support.
When you learn that you need heart surgery, it's natural to feel uneasy.
I think that the first thing you think of is, why me? I mean, you have that anger.
But as with many things in life, uncertainty melts away with familiarity and education. That's why this information is so important, because you're going to learn more about the process so that you can be an active participant in your care and recovery. The heart is a muscle, about the size of your fist, that pumps blood and carries oxygen and nutrients throughout your body. To function properly, the heart must also be supplied with oxygen and nutrients through large blood vessels called coronary arteries, which wrap around the surface of the heart and feed into its walls. Normally, blood flows easily through healthy coronary arteries, but over time, the arteries can narrow and even become blocked by fatty deposits called plaque. This is called coronary artery disease. When the heart does not receive enough blood and oxygen, parts of it can become permanently damaged or die. This is called a heart attack.
Heart disease is multifactorial. It can be from genetics, from diseases such as diabetes, from cigarette smoking, as well as multiple lifestyles that we choose.
To restore normal blood flow to the heart, coronary bypass surgery may be performed. During bypass surgery, a section of blood vessel is removed from the patient's leg, forearm, or chest and used as a graft. The graft will be used to create a new pathway around the blockage in the artery to allow the heart muscle to get the nutrients it needs to function properly. With the bypass, the blood flow is restored to the heart through the grafts, and it is not necessary to remove the old blocked coronary arteries because they have been bypassed.
Another component of heart disease is valvular heart disease. The heart is composed of 4 chambers. Each of the chambers is separated by a valve. So the function of the valves is to maintain forward blood flow. So the valves can either become too tight or too loose. In either case, the heart has to work harder to maintain forward blood flow to the body.
To correct these problems, the surgeon operates inside the heart to repair the valve. If a replacement valve is necessary, it will be either a metal or carbon mechanical valve or a tissue valve. Although mechanical and tissue valves work in a similar way, Your YRMC team will go over the one that is best for you prior to surgery.
I feel the best way to get ready for this surgery is to take control of the situation. Get information about what surgery and what it entails and the length of time that you need to heal.
The day before your scheduled surgery, you and your spouse or another family member will come to the hospital for orientation and to meet with a registered nurse from the pre-admission department, your care manager, and your respiratory therapist. During this process, we will gather your complete medical history, blood pressure, respiration, and pulse will be recorded. You will then be taken to the radiology department for a chest X-ray and an ultrasound of your legs and carotid arteries. This process varies by patient, but you should plan on a half day to complete all of the necessary steps.
When a patient comes in, it's important for them to bring a spouse or a family member with them. It's important for the patient and their designated partner in care to go through the process together, because the patient will need help keeping track of all the information they are receiving. Our Partner in Care program is for the spouse or family member, and it helps them to be a good advocate and to learn about the things they can do to help the patient and the nurses during the patient's stay.
You will receive an information packet that includes Partner in Care instructions, an overview of the cardiovascular intensive care unit, a general overview of the hospital, and other important information for you and your family.
Our patients will receive a bottle of our chlorhexidine or CHG soap prior to surgery. We do want our patients to shower using the soap both the night before and the morning of surgery. They can use about 1/2 of this bottle the night before surgery and the remainder half the morning of. We would like them to use a clean washcloth when using the soap. We want them to avoid the areas of their face and also in their genitals, but we want them to wash with this soap from basically the neck down. When our patients are done showering, it is important that they use a clean, dry towel. We would also like them to put on clean pajamas the night before surgery and to have clean sheets on their bed. We would prefer that the patients do not let their pets sleep in bed with them the night before surgery. The morning of surgery, once again, we want them to use the soap and to dry off with another clean, dry towel and to put on clean, comfortable clothing before coming to the hospital. We do not want our patients to shave the surgical area before coming because that can introduce bacteria. When the patient does get here, we will clip any areas that need to be clipped in the pre-op area.
Your healthcare team will include a care manager who will help you with your post-surgery discharge and home care planning. Together, you will outline your at-home follow-up care, and your care manager will also provide you with a list of skilled nursing, acute rehabilitation, or home health providers. Your care manager will also help you understand the post-surgery goals you must meet before you are discharged. You will learn more about these goals in the segment on post-surgery and recovery in a few minutes. You will then meet with your respiratory therapist to do some breathing exercises that will help your healthcare team benchmark your breathing performance.
Normal breathing in and out through the mouth. It's just to get used to it.
I work with the patient to do some pre-op testing with them, and then I am going to do some teaching to prepare them for things they'll need to know after their surgery. The first thing I do is an arterial blood gas, or an ABG. And then lab will come and they draw all of the rest of your labs and do their type and cross. After the blood work is finished, we do an EKG. I have my machine right outside the door to make it easy. After the EKG, we do a spirometry test. This is a mini pulmonary function test that measures the lung capacity.
During this process, we will talk to you about the principles of patient blood management and the choices you have relating to blood transfusion. You should not have anything to eat or drink after midnight, the night before your surgery. That includes water, chewing gum, mints, or chewing tobacco. You may brush your teeth and rinse, but you must not swallow. Please don't bring any valuables with you. No money, jewelry, credit cards. Leave all of that at home. Just come in with what you are wearing. Let your partner in care bring allowable items in once you're out of the intensive care unit.
Testing at pre-op day was pretty extensive. There's a lot of things to do. Your pulmonary testing. They did a very good job of telling me exactly what I needed to do, when I needed to stop eating, to be NPO before the surgery. It was kind of a hectic day, and it kind of brought it all to reality that it was really going to happen.
When you arrive the morning of your surgery, you will be taken to a pre-op area where you will change into a gown. You will be asked to remove any jewelry and personal items and give them to your care partner for safekeeping. You will also remove your contact lenses if you wear them. A pre-op nurse will introduce you to members of your surgical team, and you will discuss the details of your procedure. Before you're moved to the operating room, you will be given medication to help you relax. Once you are sedated by the anesthesiologist, you will have a breathing tube inserted that is attached to a ventilator which will breathe for you during surgery and for a few hours during your recovery.
Sometimes patients are a little bit apprehensive about having a breathing tube placed in. Oftentimes that's our greatest fear going into surgery. What we can promise them is that we're going to try and get that breathing tube out as safely and as quickly as possible. And also, while they have it in, we're going to use a combination of therapies, pain medication and sedation, to keep them as comfortable as possible. And we want to make sure that they're breathing on their own and they're awake, that they're able to communicate with us before we pull that out. And that's really how we achieve the safety as well as the comfort factors for the patients.
Yeah, no, the breathing tube was not painful at all. But you have to remember, we're just a few hours out of surgery, so you're not told to have all your wits with you, but it was not uncomfortable.
In the operating room, you will be connected to several machines. Little discs called electrodes will be attached to you in order to monitor your heart during the surgery. A typical heart procedure will last 3 to 4 hours.
After heart surgery, our patients are transferred to the cardiovascular intensive care unit, where our specialized heart nurses stabilize the patient and wean them from their cardiac medications. After approximately 1 hour, the patient's family is allowed to go back and visit with their family member.
Justin continuously updated my family about my condition, about what was going on when I went on to the bypass pump, when I was off the bypass pump, how I was doing, decisions that they were making throughout surgery. It made me feel good that my family was well taken care of. They weren't just stashed in a waiting room waiting for me to be done. They were actually encouraged to play poker, read magazines, interact, have fun. They actually had to move my family to another waiting room because they were kind of rowdy, so.
After surgery, you will be taken to the Cardiovascular Intensive Care Unit, or CV-ICU, where a very motivated and experienced team of caregivers will closely monitor the first phase of your recovery. Your surgeon will also meet with your family to give them an update on your progress.
When Dr. Tibby approached me in the room in the ICU, he mentioned to me, basically gave me an overview of what my condition was. I will tell you that his demeanor was very calm. He's an incredibly humble and comfortable person to be around. Just a wonderful, wonderful doctor.
When you wake up from the anesthesia, you will feel confused and groggy. You may also feel cold and thirsty. These feelings are common and won't last long. You will hear sounds and feel tubes and wires connected to your wrist, neck, and chest. You will also be aware that your breathing is being controlled by a ventilator via an endotracheal tube, and you won't be able to talk. It doesn't hurt, but it may feel a little uncomfortable. All of this is normal, and it is important to remain calm and relaxed. The breathing tube is there to help you, and it will be removed when you're ready to breathe on your own. If you have had bypass surgery, your legs will also be wrapped with ACE bandages, and you may feel some discomfort from the area of the incision and vein harvest.
To harvest vein now, we make a small incision inside the knee and use a scope to remove that vein, leaving a very small incision with quick healing time and better recovery for the patients. They used to make a large incision all the way down the leg and cause a lot of discomfort, a lot of swelling, and much more difficult recovery.
You will remain in bed for several hours. When your healthcare team feels that you are stable, you will be moved from your bed to a chair. Your family will be allowed to visit on a limited basis, as you will need time to rest and begin building your strength to do the things you need to do to get out of the hospital and go home. Your pain will be treated using oral and intravenous medication and will gradually become less as you begin moving and doing prescribed exercises.
All right, how's your pain level?
It's okay.
All right, if you had to put it on a scale of 1 to 10, what would you put it at?
It's right now.
You will be asked often to tell us how much pain you are feeling. We ask that you be as specific as possible to provide your caregivers with the information they need to accurately treat your pain. In addition to pain medication, you will also be given antibiotics to protect you from infection.
At YRMC, we have what we call the total healing environment. That basically means that we expect to be able to manage patients' pain to a level that's acceptable to them, while at the same time being able to safely participate in activities, breathing exercises, and participate in wellness activities. We definitely believe that pain impedes the healing process, and we need to manage it aggressively.
The staff and the doctors after the surgery were wonderful controlling my pain.
Your cardiac rehabilitation will begin while you're still in the hospital. Our staff will visit with you in your room to give you information about your recovery, and you will begin mild exercise to help you regain your strength and improve your breathing to prevent lung infections.
They want you to begin walking right away. You know, you've got a little cart with the IV, and they want you up and about. They want you walking, and they want you breathing. They give you a spirometer so that you can make sure that you don't end up with pneumonia and liquid in your lungs. That's a huge risk.
Controlled coughing will open up the tiny air sacs in your lungs and help you get rid of any excess mucus that collected during surgery. While it will be uncomfortable at first, frequent coughing is the best way to prevent fluid from building up in your lungs. You will be given a heart pillow to hug to your chest when practicing the coughing exercises. This will relieve some of the discomfort that you may feel as a result of your incision.
Well, coughing is very important to open up the air sacs in the lungs. A person has received anesthesia, everything has slowed down, and we want to help them to be able to breathe as easily as possible. That's why we provided this pillow for them. The patient will be given this pillow, they will put it on their chest, and they will hold on to it when they cough, and that should make it easier for them.
Yeah, the heart pillow is it's your buddy. If you want to, I used to call it my buddy. And I think the most important thing out of the heart pillow was you had it here up on your chest pretty much all the time, because you can't lay it down because you couldn't get to it. And the purpose in that is if you have to turn over or you have to cough, you want that heart pillow right against your heart, because it hurts to cough, believe me.
Spirometry will help you breathe easier by helping you breathe more deeply. Incentive spirometry is the little handheld device that you will place in your mouth as you take deep breaths. The goal is to take slow, deep breaths and expand your lungs.
We expect the patient to participate in incentive spirometry 10 times per hour while they're awake. That would be 10 breaths per hour. And what that does is give us a measurement of how deeply they're breathing. We expect the patients to breathe deeply, do their coughing, and participate in incentive spirometry very often. And what we're trying to do is to expand the lungs and prevent pneumonia.
After surgery, it is normal to have a decreased appetite and to feel nauseated. This should go away within a few days. Most patients remain in the CV ICU for 1 to 2 days, although this can vary. Your healthcare team will determine when you are ready to be moved. After your healthcare team has determined that you have reached certain physical goals, you will be moved to the Progressive Care Unit, or PCU. Here, you will continue the exercises you learned in the CV ICU, and you'll be given new ones that will help to speed your recovery. Your family will be allowed to visit more frequently now. Your pain will begin to diminish, and your energy will increase as you continue to exercise. There is no set time for discharge from the hospital. Some patients remain in the hospital 4 to 5 days, and some stay a week or longer. The length of your stay will depend on the progress you make meeting your specific goals. Not every patient will be discharged to their home. Some may need a skilled nursing facility or home health service. A member of our care management team will meet with you to discuss your personal circumstances. Your vital signs and blood work are stable. Your pain is managed to an acceptable level. Your breathing oxygen needs are within normal limits. Your tubes, drains, and wires have been removed. You are walking 4 times per day, as tolerated. You are eating, and bowel functions have returned. You have no signs or symptoms of infection. Your weight is returning to normal, and your swelling is decreasing. Your blood sugar is in an acceptable range. You have discussed your current medications with your physician and understand your discharge plan of care and instructions. It's important that you take only the medications listed on your paperwork. Before leaving the hospital, you will be told what to expect over the next few weeks and will be given a plan for recovering at home. A follow-up visit will also be scheduled within the first few weeks after your discharge. Before your discharge, you will also receive our Cardiac Rehabilitation and Education Manual. This comprehensive tool includes a wealth of information about your recovery process, lifestyle changes, exercise, medications, and important contact information that will keep you connected to your healthcare team after you go home. You'll begin a monitored exercise program once you are cleared by your cardiologist.
Another part of the recovery phase is cardiac rehab as an outpatient. It's a monitored exercise program. We actually have you on the heart monitor while you are exercising, and we give you a lot of good education to help you make some lifestyle changes.
I was near death. This hospital, these doctors, these nurses, this YRMC, and all of them, they saved my life.
From the people who maintained my room and replenished the Kleenex or emptied the trash in the room, to the lab people that would come in the night and take, samples, to the surgeon that held my heart in his hand.
Everybody was fantastic. Everyone from the surgeon to the cardiologist, nurses, aides, everybody was fantastic. I had absolutely phenomenal care the whole time I was in there.
I can't say enough about the nurses and the staff in the cardiac ICU unit who just took intense care of me.
They were caring. I did everything that they had told me to do, and that in turn made me get stronger and healthier.
It was very important for my family and I to be close to home during my surgery. It eliminated No one needed to go get a hotel room. Everyone was in a familiar spot. Here at home, I had family come in from all over the country, so they could stay with, with relatives.
Everything you need is really right here in the Tri-Cities area, and it's first class. There is no reason to think about going someplace else.
And we have it here now in our own hometown right here. Our own YRMC hospital, our own heart center, and our own doctors.
Trust your doctor, your surgeon, get it done, heal, and go and enjoy life.
We brought world-class heart surgery to the Quad City region because we care about the well-being of the people who live here. You can rest assured that you will receive leading-edge cardiac care delivered by compassionate and highly trained professionals who are supported by the most advanced technology. This is our pledge to you from the James Family Heart Center at Yavapai Regional Medical Center.